Ladies and gentlemen, welcome to our video today. We will be doing a medical video weekly that involves common conditions. Remember that all the medical videos that we are going to do are proudly sponsored by Genesis Medical Center. Today's topic, we are going to discuss kidney infections and urinary tract infections. I'm sure quite a good number of you have been treated with urinary tract infections. We want to see what these, how do we get to get urinary tract infections, how do we prevent them, how do we treat them, should we be scared or not. And when it comes to urinary tract infections, we're going to divide them into two, and we're going to tackle them in two different videos so that we don't make our videos very long and boring. One, to make them short, palatable, minimal medical jargons, so that each and everyone can understand. These videos will be fit for students, practitioners, and the general public. For any questions or anything that we do not tackle as you wish or would have wanted it to be explained to you, you can always comment on the comment section, and we're going to tackle it promptly. So now let's dig in, let's get into it with urinary tract infections. We said we are dividing them into two. We have the upper urinary tract system and the lower urinary tract system. With the upper urinary tract system, it involves the kidneys and the ureters. Anything that comes out of the bladder, urethra, going down is the lower urinary tract system. And today we are going to start with the lower urinary tract system. Then for the next video we are going to tackle the upper urinary tract system, hopefully. So with the lower urinary tract system, when the urinary tract system is okay, normally physiologically, all bacteria are located at the far end of the urethra. We normally have bacteria there. So these bacteria, when they are there, and all mechanisms, preventive mechanisms, or the anatomy, the physiology, everything is okay. We do not have any bacterial infections. Now, what is a UTI? A UTI is a urinary tract infection. And when we say there is a urinary tract infection, this comes when we get to have multiplication of these organisms to a tune of 100,000 per ml of midstream urine. So what is midstream urine? Once you collect a sample of urine that is not at the beginning of the stream and it is not at the end of the stream, whatever you get in between, that's what we call or refer as midstream urine. So with midstream urine, if we do get about 100,000 organisms per ml, it implies that we are having a bacterial infection of the urinary tract system. And the reason why we do not collect the first or the last is because there are chances that we are going to get organisms from other sides, maybe from the tube collecting, maybe from in your hands, or another thing that can contaminate the urine, and it will be counted as organisms, and we might give you a diagnosis of a urinary tract infection, whereas the organisms really did not come from the urine. Such infections, UTIs, are more common in women more than men, generally because of how anatomically a woman is built as opposed to a man. Women at the age of 20 years will have a prevalence of about 3% of the cases that get, and for every decade we are going to have this increase by 1%. We'll see later as we go down the reasons why we are getting that with women. For men, commonly we are going to have urinary tract infections in children under 1 year and men above 60 years. That's where the prevalence is more. And basically this is because under 1 years mostly we are using diapers, they hold urine, increase chances of multiplication of bacteria. For the men above 60, we have things that come in like BPH that bring in obstruction and so forth and so forth and so forth. We end up getting an increase in prevalence for those groups. We go on. So we go to pathogenesis, and pathogenesis, this is the process by which you get a certain disease or how a disease develops. For UTIs, we are going to have them divided into two. We have the complicated and the uncomplicated UTIs. For the uncomplicated UTI, we are going to have one, the anatomy and physiology is going to be normal. Then number two, we are going to have normal renal function. Third, we are going to have no comorbidities that do affect the defense mechanisms in our bodies for the UTI. For the complicated UTI, the opposite of what we have said above. So number one, we are going to have abnormality in the anatomy and physiology. That is, we may have things like obstruction and or stones, things like calculi and so forth and so forth. Number two, we are going to have renal function. The only way we do tell or know that we are having a renal function is by doing a test, renal function test, and by that you can tell whether you're having normal renal function or if it is impaired. Then the third and the last thing is that we are going to have things like other comorbidities that do affect the defense mechanisms for a UTI in our bodies. That is like patients who have diabetes and patients who are immunosuppressed. Outside the hospital setup, the commonest cause of a UTI is E. coli, up to 70% of the cases. We do have other organisms that give us now the remaining about 30%. We have things like Pseudomonas, we have things like Streptococcus, Staphylococcus, Epidermidis, and so forth and so forth. Now, in the hospital setup, we have quite a number of organisms that will contribute to UTIs, and these include organisms like Klebsiella, Streptococci, but again, E. coli is the main culprit. The first stage in development of a UTI is colonization of the periurethral region by these microorganisms. If the microorganisms tend to increase in number, now this gives us the infections. In women, the ascent to the bladder is associated by the fact that the urethra in women is quite short. For men, they have a long urethra, then the travel distance for the organism is quite long, so minimizes the chances of developing a UTI. For ladies, the distance is short, quite a good factor that increases the prevalence in ladies. Sexual intercourse may cause minor trauma sometimes to the urethra, and it opens up a window of maybe increased inoculation of the bacteria hence you get a UTI. But that does not mean that a UTI is sexually transmitted. It's only that the intercourse, the trauma, will lead us to having chances of having inoculating bacteria, hence getting a UTI. So, to be specific and precise, a UTI is not an STI, but chances may be increased due to sexual intercourse that you may develop a UTI. Things like instrumentation as well of the bladder may introduce bacteria and may introduce those organisms, and you end up developing a UTI as well. Now, when it gets to investigations, we need basically to have a urinalysis. A urine analysis always needs to have the analysis done and microscopy done, so that the microscopy supports whatever you get from the urinalysis. If they do not tally, get to ask yourself why. If they do tally, well and good. Now treat whatever you get. Two, we might need to do a full hemogram, a complete blood count. A complete blood count, basically we do it in order to either confirm it's true you are only having a UTI, or if there is another infection or disease, because a UTI might mimic other medical conditions, and if we treat you for a UTI alone, maybe you're having another infection, we might not get to get a complete healing. So we either do the full hemogram to either confirm that is true, this patient is only suffering from a UTI only, or if they are having any other diseases. We will need other investigations as per the presentation of the patient, and basically in the developed world, before you start any medication, most of the patients will have a urine culture done, but in our setup, quite not realistic. But for those patients who are either going to have persistent UTIs, will need to do a urine culture to get to know the organisms that are present and which drugs are sensitive. There is a difference between persistent UTI and recurrent UTI. If we do treat you today, you come after treatment, and we get that you do not have the bacteria are cleared, then you come back again after a week, you have a UTI, you come after treatment, the bacteria are cleared, you come after another week, you're having a UTI. That is recurrence. Persistence is when you get the infection, we put you on treatment, you come, we repeat a test, it is still having those organisms, you're still having leukocytes in your urine, you're still having parcels in your urine. We change medication, we give you different medication, you still come with a UTI. Now that is persistence. In such cases, we really want to know what is happening. And from the investigation, sometimes in a urinalysis, you'll notice there is blood in urine. Blood in urine might be there in a UTI, and again, it might be there to signify that there are other issues. Whenever doing a urinalysis, always pay attention to protein and blood. You get protein, you get blood. What is the blood pressure of the patient? How is the patient presenting? Are they having edema or not? How much blood is blood coming during or after intercourse? Is there associated pain? Where is the pain located? When and what is the amount of the bleeding? All those things might guide us and tell us about other diseases, and that goes to all practitioners who see these patients. We have to pay attention to that. For some infections that tend to be quite disturbing for the recurrence, persistence, we sometimes need to request for a KUB scanning. We do visualize all those organs, see if we are developing any tumors or if there is anything else. Then I think we said about the urine cultures, so that when you do the cultures, you get the responsible organisms and what drugs are sensitive. Then, last but not the least, we have things like cystoscopy. which is rarely done. But in cases of persistent blood in urine, we need to do a cystoscopy to rule out any tumors or any other causes of to get to know what is the cause of the bleeding. On to clinical features of a UTI. A UTI, you're going to get a number of symptoms or features. One, we're going to have increased micturition. The frequency is increased. Two, we have associated pain. Three, we have you empty your bladder. Once you empty your bladder, you get an urge of emptying the bladder after you're done with emptying your bladder. Then there is also sometimes the blood in urine. Then urine may have unpleasant odor. And then we also have the other associated things like the suprapubic pain and for some lower back pain. With that, we can go to the management, and with the management, it will depend on a number of issues. Number one, what is the target organism? And that's when we get now to choose what antibiotic we're going to use. But basically, when it comes to management, number one, we need good hydration, more than 2 liters in a day. Number two, we need you to have pass urine more frequently, basically around every 3 hours. Then we will have double micturition if reflux is present. Now, what is double micturition? That is when these patients pass urine, and then after around 15 minutes, they go back, try to pass urine again, even if the urge is not there. When it comes to drugs, we have a number of them. Penicillins are good, cephalosporins are good. We have ciprofloxacin, we have erythromycin, we have cephalexin, and so forth and so forth and so forth. But remember, always when attending to a patient, these will be individual case centered to this patient, because things like pregnant women, there are drugs that we cannot use in pregnancy. Again, we also majorly have to look at the resistance rate as for different drugs. Always have in mind the more a drug is resistant, the more likely that the patient won't respond well. So look at the resistance rate of things like the cephalosporins, the penicillins, then go for drugs that don't have a high resistance. That is our medical education for today. For any questions that you may have, contact us through the comment section. We'll humbly respond to all your queries. Thank you for listening, and I'd like to remind you that this medical segment has been sponsored by Genesis Medical Center. Adios.